Now it is my pleasure to introduce Dr. Richard Carpiano for our next session. Dr. Carpiano is Professor of Public Policy at the University of California, Riverside, a public and population health scientist and medical sociologist by training. Dr. Carpiano studies how social factors such as socioeconomic status, race, ethnicity, and community conditions contribute to the health of adults and children. A substantial focus of his research concerns social, behavioral, attitudinal, and policy factors underlying vaccine uptake and coverage or refusal. As part of his work, Dr. Carpiano is presently a member of the Lancet's Commission on Vaccine Refusal, Acceptance, and Demand in the United States. So welcome, Dr. Carpiano. We're looking forward to your presentation.
Well, thanks so much for the introduction, and thank you so much for the invitation to be here. This is great. I guess I had to turn this down 2 years ago, and regretfully, or actually it may have even been earlier than that. But anyway, it's great to be here, and amongst this crowd, well, first off, before I get going here, I just want to double check. So can I just post my PowerPoint and just do share screen?
Absolutely. Yes.
Yeah. Okay. Great. I just want to make sure that
and I can also do a poll or anything you want. Sound like you were going to ask about the audience, but.
No, but actually, how many are here? Just so I know who I know how many. I know the audience a little bit. I can see a few tiles, but I can't see.
Yeah. So, Dr. Carpiano, you have 130 people in.
Oh my
audience.
goodness! Oh wow. Okay, because on my screen it looks like there's 6. Okay. well, welcome everybody. So, oh my goodness, and I opened. Okay. So today, I'm going to do something that's a little bit more of a. This is a group I'm really excited to talk to. I really want to hear experiences. I want to engage more in instead of doing sort of a traditional sort of typical kind of talk that I'm used to doing. It's sort of very said and very kind of scripted. I wanted to do something that was kind of a little bit conversational and bring to the table some of the ideas that I've been thinking about and considering with regards to all the great people I've been working with on the Lancet Commission, who are, many of us are academics. There's some clinicians, there's some people who work more in the practice space, some people who are legal scholars, some are ethicists, for example. And so I wanted to share with you some thinking where we've been going with thinking about how to address uptake and the current issues that COVID has really just sort of thrown out of the sky and onto our laps and made even so much worse. With your perspectives of everyone who's really working on the ground, who I have the most tremendous amount of respect for, pre-COVID and now especially with COVID in terms of how the landscape has really changed so much. So what I'm going to do is I'm going to talk just about some sort of general ideas and ways of thinking about improving promotion of vaccine confidence and uptake, and really try to get at this. I'm going to keep it pretty simple. I just want to think about ways to better address, to me, I mean, this is, obviously we all work in this. It's one of the most important areas, of course, what we would tell anybody. But I really, having worked in public health, for over 20 years now, and in terms of all the issues that are out there, I think the extent and the complexity that vaccine hesitancy, as well as its extensions into so many other domains over the past 2 or 3 years now, has been really is one of the most challenging public health threats that we're seeing now, both in the United States as well as internationally. So really, I want to make this much more about a conversation, as to hear also your experiences, some of your thoughts on things that I have to say. Make this a little bit more of a dialogue. But anyway, with all that said, as a preface, let me get into it here. So, just to make sure that we're all on the same page of where I'm kind of approaching this is, really it's been amazing in a very concerning, very troubling, and for as much of an optimist as I am, it's sometimes a bit more pessimistic sort of view about how COVID has really just transformed the landscape in terms of vaccine hesitancy and vaccine uptake. And I'm going to fully admit it publicly while I'm being recorded that when COVID first came on the scene, I really thought to myself, well, this could probably suck the air out of the anti-vaccine movement. I mean, you can laugh at me right now. It's totally fine. I get it, and I'm going to totally own it. The classic cliche we were always hearing about, vaccines are victims of their own success. Well, in the United States, we've been very privileged, and we really haven't had a pandemic to really think about. I mean, we had HIV, but people didn't think about that in sort of the same way. We had, we had some measles. We had measles outbreaks that were kind of regional, but nothing sort of the scale that we might expect to hear in the news from countries, thousands and thousands of miles away, for example. So I really, I very naively at the time thought that this. I don't want to make it sound like, oh, it's a great thing. Here comes a pandemic, but the idea here of, good, the public will see the importance of vaccines, they'll see the importance of infectious diseases, and the importance about science and about public health and more generally. Sadly, I couldn't have been more wrong, which in many ways has been a bit disconcerting, but nevertheless onward we go. And so really, we've seen over this, just short time period with the anti-vaccine activism, just this evolving rhetoric and messaging that's really been quite fascinating, particularly here in California, when you think about how after SB 276, there really wasn't a whole lot of space for the anti-vaccine movement to kind of go. I mean, they kind of took a bad hit, took two bad hits with SB 277 and then SB 276. And then so to watch them sort of expand their base into just more sort of disinformation, anti-government rhetoric, and it really was, in a sense, very much a trend that we were seeing pre-pandemic, of course, where this kind of movement away from trying to challenge issues on science, where we would see things related to autism claims, for example, being one of the most classic examples of that, to much more of this philosophical focus upon liberty and medical freedom. And these very kinds of libertarian kinds of ideals that are just so much harder to argue because they're about values in many respects. And also we were seeing, of course, this other alignment with right-wing political identity. Moving away from, as some of my colleagues would call it, the granola left, to being much more sort of aligned with right-wing and particularly some very fringe kinds of right-wing political sorts of causes, which really, in a sense, was what we would call in sociology, we would call this, building of social capital, that it really enabled them a lot of access to money, political clout, as we've been seeing both at the state and within state-specific contexts throughout the United States, but also in a national and even international context, and also sort of gaining sympathy with a broader audience or market-based, depending on how you want to approach this. Then along comes COVID, and everything sort of blows up from there. We see this sort of, this expanded discourse, moving from what was really heavily around child vaccines now to adult even vaccines, to COVID-19, to just and broader just public health issues in general. And that's also why I added before about how I really think that this presents even more of a complex problem for the 21st century than many things that we've seen in public health beforehand, because it extends to so many other things and gets right at really gets at the heart of the profession, and not just the profession in terms of sort of reputation and things of that nature, but in terms of the importance of it and what exactly public health does for providing for the general welfare of our nation. And so in addition to that, while we might think of the traditional sorts of actors that we've seen in this space, the Robert F. Kennedys and the Del Bigtrees and all that, we've also seen this concerning arrival of sort of these sort of sometimes tangential, sometimes more directly sorts of involved influencers or actors coming from different spheres. And in some cases, people that we might not explicitly call them anti-vaccine. I mean, we could certainly sort of label them in terms of what their approaches are and some of their positions. But might come off a little bit more seemingly legit to a lot of audiences, in the sense that they are people that are not necessarily the fringe, but they have legitimate academic appointments at respected universities, for example, or have had reputable sorts of reputations prior to COVID, for example, and as a result have access to some really effective platforms for pushing their viewpoints. And so we've seen this expansion of these different strategies and tactics, which really make the challenges that we're facing. I mean, I don't have to, in some ways I'm preaching to the choir here, present even more challenges to us going forward. And even if COVID were to magically go away tomorrow, that we would still be facing, and not even just in terms of vaccinations. So what are they, and how we kind of think about them kind of in my networks are, if you kind of sort of some of the three key things, some of the three key sort of strategies and tactics that get used is one that's been an ongoing one, of course, would be influencing public opinion. Again, moving from vaccines to COVID-19 more broadly, and now even more expanding into public health, other public health domains, and as well as the ongoing past was prologue in terms of targeting historically underserved sorts of populations, trying to undermine or sow doubt around vaccines, public health, medicine, for example. We've seen now activism at multiple levels, where we might have seen, particularly, for those of you from California, definitely, the pictures of people at the State House, crowding the State House for SB 277 and 276 later on. Those things still, at least to me, resonate quite heavily. But now we're seeing much more of the old adage of all politics is local, and definitely much more of activism at school board meetings, for example, or county supervisor meetings, and challenging different sorts of efforts, or even trying to preemptively raise these issues and poison the well before really a solid, honest discussion can be made about what exactly to do, what options exist, and what might be the best policy for a particular community. And the third is, one which maybe this resonates, I hope not, with some of you in this room, but the silencing and the threatening of experts, where it might be one thing to be challenged online or on Twitter or something of that nature, but it's another thing when you become targeted for harassment or some sort of intimidation. We've seen this with public health professionals. We've seen this with academics. We've seen this with basically the whole, you could say, the entire sphere of vaccine advocacy, for example, and that's now extended over into other realms of the public health community. So what really can be done at this point? I mean, we've seen this incredible complication of, while vaccines were increasingly getting politicized, we've seen now where political identity has become an ever stronger predictor of vaccine attitudes and beliefs and intentions, and so that's a genie that's gotten out of the bottle, and it's very hard to put back in, to put it lightly. And we also have seen a much more sort of complicated, or you could say more polluted, information ecosystem that's out there, in terms of misinformation as well as disinformation, intentional sorts of points trying to be made to sow confusion or doubt or undermine trust in vaccines or in public health itself, and that seems to be ever more again, getting us into this kind of information system that's ever more polluted, and that seems to have hit the United States almost as fast as COVID did, but has extended now into so many other domains, and now even threaten existing sorts of public health policy related to vaccines and other issues. So really the overarching approach is where we've been kind of trying to think about this of what going forward should we start to expect, and what might be the best ways to try to address that is, I mean, one of the first things would be to treat is the importance to keep emphasizing ourselves and thinking about this within our own community, that vaccine hesitancy is a public health problem. It's not just some sort of clinical medicine problem where we can think about communities or populations as just aggregates of individuals, and that this is something that just gets addressed within healthcare settings. That this is something instead that we really need to be thinking about as it's a community issue. It's going to involve a broad, it necessitates a broad coalition. And so now some of that might seem obvious to all of you here, but I think over COVID, we've started to see more, particularly, I've been seeing this more in the media. Media tends to focus very heavily when it comes to health around medicine and clinical care, and makes it very personal, and makes health issues very personal. And so that type of framing does resonate with the public, and it tends to make infectious disease in some respects not all that much different than high blood pressure or diabetes or angina. And these things that are very individual, that are very personal, that really don't have a huge amount of impact upon other people within our community. If I'm eating a hamburger and every night for dinner, and I'm starting to develop, the analogy I like to use is, suddenly I start to develop angina or some other sort of cardiovascular problem, that's not going to have much of an impact upon my neighbors. But so it's a very different type of mindset that the American public is generally just not used to hearing, because we're used to hearing, and experiencing it in our networks of people dying of things like cancer and heart disease and diabetes and these other things that are very chronic, non-infectious, and that are very personalized. And that fits very well, of course, with a very American, individualized, libertarian in many respects in our DNA kind of worldview. And so that also complicates us trying to think about vaccine hesitancy, or at least communicating that in as a public health problem. Again, something that affects an issue that affects populations and requires a multi-pronged, interdisciplinary, multi-sectoral type of approach towards correcting it. The other thing that really seems to be at the center of so many of the ideas that when we're trying to aggregate and kind of seeing about sort of evidence and discussion of what sorts of techniques are really out there and what might be leveraged, really networks lie at the center of that. And really building communities and coalitions are important, making sure that individuals that are involved are themselves networked together and creating really tight, dense, and broad networks that span not just their local communities or just the state of California, but span the nation and span different levels of government and different types of action in that regard, and even in some respects international ones, in terms of thinking about how we can reach the public at the most opportune time, hopefully most ideally ahead of any sort of disinformation that might be getting out there, or other types of campaigns, coordinated or not, and really get them where they're at on the right channels. And not everything can be done by social media, although that's certainly a big medium now, and doing it, of course, with the right messengers. Having an egghead professor like me talking to public isn't always the best thing. Whereas Ian, for example, could probably in many respects be much more effective maybe in his community than I can. Or what other sorts of influencers might be able to bring in, or trusted other leaders in the community. I see two hands up. Are we doing? I'm happy to do questions now, or if we want to hold them off until later.
Yeah, let's hang on for a little bit. We'll look at the questions and have Dr. Singh jump in there. But thank you.
Okay, great. Okay, so with that, we have to, in many respects, it's sort of, I hate to use the analogy, if you can't beat them, join them, but it is in a sense of, we know that anti-vaccine activism is highly effective. They're very well coordinated, they're very well networked, and so there's nothing wrong with taking some lessons from that and thinking about how to beat them at their own game, in terms of trying to stave off the damage that they're doing, in either as upstream and primarily preventive as possible before those messages get out, or to correct things once they do come out. And so really, again, this idea of how can we think about ways to be as multi-sectoral and thinking about communities and healthcare partners and schools and the private sector, as well as sort of multi-level in terms of thinking about the levels of government, different agencies, for example, in terms of how to coordinate particular types of actions. It's tricky, it's challenging, but in essence, I mean, it's essentially what what we have to be forced to be thinking about it as sort of the best ways to try to deal with a very 21st century public health problem. So let me get down to maybe some specifics of different ways that we've been kind of thinking about this. So one of them is about rethinking how we do public communication, public education and messaging, for example. So a big problem that we've seen during COVID is that public health communication itself, and this is not, what I'm going to offer here is, I know there's public health professionals here. This is not me sitting here and offering criticism of the hard work that people in the audience are doing. This is me raising these things as sort of constructive points to be thinking about how can we be doing things better. I recognize the fact that we've had resource limitations. We've had to respond to COVID, in a rather rapid kind of manner. So of course we've been, those have all presented challenges in terms of effectively addressing different sorts of problems. But the fact does remain that this is in the United States, that the way our government gets set up is that we are that public health does tend to get siloed by state. And even by particular institutions. I'm sitting here, I'm excited to be here with this audience, and in a way, I represent, in some respects, a sphere that isn't always as engaged on the ground and with practitioners and advocates as we ideally should be, in terms of learning, in terms of sharing what we might be able to know, or how we can work together in terms of being partners. And so there is at times a lot of minimal sort of coordination and a lot of just sort of ad hoc sorts of activities that that in essence, remain still very grassroots in that regard, which is wonderful. But we need to be thinking about how to what sorts of strategies can we be using to better coordinate that, in terms of making sure that messages are consistent to not just specific populations, but sort of just broader audiences in general, as a way to show consistent sorts of points and get those across. Very much in the way that anti-vaccine activism and other sorts of bad faith actors operate. And so really, when we think about, a lot of what we've had to do is very much reactive. So how can we think about this going forward, to being in a more proactive way, in terms of bringing in influencers, professional influencers, or people from other sorts of spheres that could be very helpful in terms of our communication efforts. And one potential solution that's out there, that's been proposed, that comes out of other spheres of government activity, more with foreign policy and other sorts of areas, is this idea of evolving or moving away from this sort of one expert, one credible kind of messenger model, to something that's more broad, diverse, and coordinated, consisting of a whole network of expert messengers and influencers. So the example here and what I have with the diagram here is so you have Anthony Fauci. I mean, I'm going to date myself. I'm a proud Gen Xer, but I grew up pre-internet when you had just your information came through a couple TV networks and the nightly news, and you had a couple, information got filtered in very specific sorts of ways. And so that model of having that one expert that we would turn to hear about what was going on, what worked for that time period. It was very good. But as social media and really just the media landscape has sort of opened up from the 1990s onward, there's so many avenues and different channels for people to put out information, not all of it accurate, and sometimes not all of it intentionally accurate. And in that case presents a whole different sort of landscape in the way we have to do this. And so by having that one messenger model, unfortunately, as we've seen with Dr. Fauci, as we've seen with Dr. Walensky with the CDC, as we've seen with state officials as well, is it provides a situation where there's a pile on by anti-vaccine and other other sorts of bad actors, where maybe one gaffe or one particular sort of point, even if it is accurate, it's not a gaffe, is chipped away at and undermined, and it's associated with an individual. And so there's a very kind of ad hominem or to the person sort of logic that goes with that, so that if you discredit the person, then you discredit the points that go with it. So by moving to a broader, diverse model of messengers, in this case, as it describes here, 1 million messenger model, and having more coordinated kinds of messaging, it makes it so much more difficult for that situation to occur, because it doesn't provide one consistent sort of entry point, or there is no sort of heart to the creature in essence that's putting that out. And so, again, thinking forward about how we might be able to better coordinate from local, state, federal, cross-state sorts of groups, and this is a theme that I'm going to keep getting back to, is going to be really heavily important going forward as we think about 21st century vaccination messaging and promotion, as well as even just broader public health. Second issue is improving activity coordination, which in essence sort of ties to this communication issue that I just talked about, but it gets into more broader sorts of activities, in that what are ways that we can be thinking about how do we improve the structures that enable us in this space to be better networked and better aware of events and other sorts of occurrences that pop up when they do. And so we've seen, for example, there's been different sorts of initiatives like Project Vector and the Virality Project that have adapted social listening techniques as sort of almost like a surveillance sort of opportunity to be better aware of the landscape and what's going on, what people are kind of saying online, what people are thinking, what's circulating, what kinds of information, good or bad, for example. And that with that having use, that's a useful tool for responding sort of accordingly and thinking about particular types of messaging and even other sorts of outreach that we might want to do. But again, how to think about not just, I subscribe to Project Vector. I get messages from them, but again, I'm a lone person and who does public outreach, and I don't do it really in coordination with anybody. So how can we think about ways to bring together these kinds of partnerships that leverage information like that, for example, and to make people more aware of what's going on, and so that we can be better connected in all different parts of the country, different regions throughout the state, for example. And that's going to include even legislation, which in a sense is its own sort of sphere, and which requires a lot of attention and a lot of time to be following. And so particularly if you're so involved in things related to maybe your county or your local community or the state of California, it's hard to keep up with what's going on in Rhode Island or Maine or New York City or New York, for example. And so really, thinking through about how to better improve that coordination to be able to be more proactive in getting us to engage, as well as to be able to increase our advocacy regarding specific legislation. How to really get to how to get an early jump, as early a jump as possible, to lawmakers and elected and appointed officials about specific legislation, and to leverage our expertise and our know-how and our knowledge about what could be good or bad about something and why it's important to support something or to even to oppose it. The third element is what we're thinking about, is sort of a coordinated threat response. So again, this is going to be thinking about the role of networks and bringing this together more tightly, but for a slightly different purpose. In this case, more reactive. It could be very proactive, and preventative, but definitely a tool to try to deal with a lot of this kind of bullying and harassment, and ultimately the undermining and discrediting of public health experts, medical doctors, scientists, advocates. You name it. Even elected officials who are very pro vaccine or more broadly sort of pro public health. And so, what are some different ways that we might be able to leverage networks in ways to better address and respond to online threats and harassment campaigns, so that we don't see things like again, like Nicole Quick having her I mean, it would be very hard to sort of unfortunately prevent her an address being doxxed, as in the case of her. For those of you who are not familiar, she was the Orange County health official who had put up a mask mandate in Orange County, and in a public meeting by a very well-known anti-vax activist, had her revealed her home address. And so, of course, a crowd then swarms to her house outside. She has a family. Of course, that's going to be viewed as threatening and intimidating. And within a couple days, she resigned from the position. And unfortunately, her successor rescinded what was her order, sending a very disconcerting, to say the least, message to the public that essentially bully tactics and harassment are ways to win, are ways to beat good evidence and good scientific based evidence, and ultimately undermine public health. So what are some ways that we could be better allies for each other, and after a while do this effectively enough in terms of defense so that this is sort of discouraged even as a tactic, that people who want to start to try this stuff know that they can't get away with it. I have down here Shots Fired, which is some of you may or may be familiar with, which was started by a group of MDs. Now I'm forgetting where now, but nevertheless online and on Facebook, which essentially tries to get people mobilized for when people are starting to be the subject of harassment, that people can flock online to their defense, can get into their feed, can try to amplify messages or stay in defense, or in essence drown out a lot of that toxicity and other sorts of activities that might be there. So are there ways that we might be able to think about extending that and moving it even beyond the social media space? It's one thing to be called bad things online. It's another thing when you start to see sort of protests outside of public officials' homes and all that. So and certainly that's might have some implications for thinking about different types of organizations, and that could be started with that. For example, social welfare organizations. And then the last one that I just want to get at, I want to be cognizant of time here for discussion too, is something I guess that's even closest, I guess, to my heart as a professor, is funding knowledge generation. Certainly there was an explosion of in the past decade or so of vaccine hesitancy research, but the whole landscape of COVID has just sort of so transformed things that I have to admit, when people want to say, well, let's leverage what we kind of know about this or that to now and see what we can kind of do in the situation, I worry a bit as to sort of in some respects how generalizable some of that pre-COVID information might be. And now also we're dealing with the complications of not only just more politicized vaccination, the idea of vaccinations being more politicized, but also just this the idea now that really where adult vaccinations, in this case COVID vaccines, are very much part of the discussion as well. And adult mandates, and it's not just about vaccines for kids. and issues that kind of strike at the concerns of parents, whether in terms of hesitancy or even in the sense of the more of when we get to extreme sorts of activism, where it starts to become sort of a political identity with that. But we really need to see some more funding, better funding opportunities for that kind of work. And when I talk about research, I don't mean that in terms of let's just do academic kind of stuff and that. I mean like actual research that's going to inform practice. And that's very applied. Evaluation research. Lots of initiatives that have been tried out during COVID in terms of community-based things, going to communities, bringing in community leaders as voices to try to promote vaccines. Let's evaluate that stuff. What approaches work best? What might not work, or in what particular situations, for whom and for what, and under what sorts of circumstances. And so, really, again, when we think about California. I'm very proud to be part of the UC system, one of the largest public university systems in the world. And just the critical mass of expertise and the willingness of, I can just say it in my school alone, the willingness to be engaged with the public and engaged with community partners in terms of doing kinds of actionable kinds of work and informing practice, is part of what is very heavily part of what we do. And the same thing applies to the Cal State system as well. So really different ways that there might be different ways that the state we could be thinking about allocation of seeding research collaboratives, for example, or when funding is given out for particular initiatives, having for requests for evaluation. Does the program work or whatever, that these could be presenting opportunities to really do good, hard, systematic types of research and evaluation of these programs. And then lastly,
Dr.
we run out
Carpiano,
of
we
time?
have just about a minute left. If you don't.
Oh gosh,
Fine,
I'm totally
That's
running
okay.
over. Then I'm
That's
just
all
gonna end here and say we also just need more information on surveillance in terms of thinking about the extent of vaccine hesitancy, public attitudes on policy. And really, the data sources that we have now are a bit scattered. The data are not accessible. Kaiser Family Foundation's done a great job, but there are questions that would be more ideal in some cases that they could ask. If you bring some experts to the table on that. It'd be great to be able to access a lot of these organizations' data itself. And so how we can basically get more of a barometer of what's going on in a more sort of systematic way would be informative for what we're doing. And with that, I'm going to end, and I'm going to apologize because I said there was going to be time for Q&A, and I clearly went over on that. So my apologies.
No, absolutely not. You are perfection, and we put more on our plate than we like a great buffet. We put more on our plate than we could manage. But this is so important, so amazing. Dr. Singh, are you able to bring your screen back up?
Yes.
To ask a few questions?
Absolutely. Thank you so much, Dr. Carpiano. There were some really important insights there that we can all learn from. We have only about, I'm afraid, 3 minutes for Q&A, but there's a great question here, which is if you could elaborate on global activities that we can learn from to address things like anti-science, vaccine hesitancy, etc., best practices that might come from, say, the WHO or UNICEF, etc. Great question.
It is a great question. And, I'll have to admit, like most Americans, our problems have been so, I guess you could say sort of extensive, that it's very easy to be, very mired in US issues. Although that said, I am very familiar with the Canadian landscape as well, which in many respects has a lot of similarities to what we're experiencing as well when we think about the politicization, the types of coordination, the types of rhetoric, and the types of messaging with that. And certainly, we've seen now some of, for example, Robert F. Kennedy Jr. going over to Germany. We've seen, even before COVID, we saw some very concerning sorts of rise in anti-vaccine sentiment in Italy, for example. So the WHO is, it's definitely should be viewed as a partner, and this should not just be viewed as this is an American problem, and we need to be just solving our own and thinking about our own sorts of solutions. Their SAGE working group has been in terms of vaccine hesitancy. I don't think I'm getting the title name of the group correct, but has brought together some of the best people that I know working in this space in terms of researchers who are really doing a great job in terms of compiling evidence, trying to think about sort of best practices. And so even in terms of just communicating to the public and being an advocate in different sorts of steps. So very actionable, very practical types of work. So I would encourage anyone who's unfamiliar with that to definitely to check that out through the WHO.
Thank you so much. That was really terrific.